Right now, when you go to the market, when you see the crowd there, it's too much.
There's COVID-19. We will not open the lockdown. We will still be on lockdown. But you open the lockdown, so there's no COVID-19.
Say Diano, say ya, right, yes, Shishaya. Nessa me your trinity, me Nantina Miakwaso, Pepe, necessary idea won't come in free.
Many like these boys and this elderly woman have doubted the reality of COVID-19, hence their refusal to adhere to safety protocols. In attempts to portray the seriousness of the virus spread in Ghana, the media has largely focused on the growing numbers and deaths recorded. But Director General of the Ghana Health Service, Dr. Patrick Kuma-Aboagye, says current data shows that Ghana is in control and asks the media to report the brighter side of the story.
So for all those who have had positive, who have become positive, you take out the number who are recovered, and the rest is what is active case, and that is what most countries depend on. But that's what is going to be the case burden. That's the kind of challenge you face, not the people who are recovered. You can see that trend that shows up that you've gone up in the last few weeks. We have seen a decline coming down across the country in everywhere we are. And so it seems that even the number of positive that feed into the number of active cases is also on the decline.
While reiterating this position, Information Minister Kojo Nkrumah called on the media to keep on reminding citizens not to relax as a result of the apparent success.
We want to ask you to caution the general public not to use the improving recovery numbers and the declining active case numbers as a reason to be reckless. The conversation we have had from the very beginning about the preventive etiquette of being careful, washing your hands, using the sanitizers, wearing the masks, to ensure that you don't even become part of the positive numbers in the first place before we look forward to your recovery, etc., remains. And I really need to stress this point, that while making the point that the data is improving, please make a point to quickly include in that same point that, however, it should not be a basis for anybody to be reckless or to feel that we are out of the woods yet.
For some time, Ghana's major testing centers, Noguchi Memorial Institute for Medical Research and the Kumasi Center for Collaborative Research, recorded backlogs due to unavailability of test kits. But head of virology at the Noguchi Memorial Institute for Medical Research, Professor William Ampofu, says the situation will no longer be the same.
We also did an emergency procurement through the Ghana Health Service, supported by the COVID Trust. And those items also arrived last week. So again, we're showing you pictures of some of those items. These are very important items, especially for Noguchi and KCCR, because they enable us to do automated extraction of the nucleic acid. And this will help us get through the backlog, which is a point of interest for some of us. Over 4,000 packs of Danjin PCR kits, about 107 cartons of nucleic acid extraction kit, various sizes of pipette tips, which unfortunately were in short supply and led to the suspension of work in some of the labs that we experienced recently. We also had various lab supplies which are shown here, which enable us to proceed with the work. And these are shown in the next slide as well.
Information Minister Kojo Nkrumah provided updates on the status of the President and the Senior Minister Yao Osafo-Maafo.
Is expected to resume out-of-home engagements from tomorrow after a 14-day precautionary self-isolation period. The President's precautionary self-isolation was on the advice of his doctors after at least one person within his close circle tested positive a couple of weeks ago. The President has, during the period, been working from the presidential villa at the Jubilee House. He's expected to, from Monday, attend to business from his office at the Jubilee House. Additionally, he will attend to some engagements outside Accra during the week. Senior Minister Yao Osafo-Maafo, you will recall, instructed us to announce his positivity to the country a couple of weeks ago. He has been on supportive treatment at home since. He has, as he informs us, voluntarily tested again since, and he instructs me to update you that his tests of Thursday returned a negative sample.
The West African Senior High School Certificate Examinations (WASSCE) starts on Monday, July 20. Once again, government shut down calls for a cancellation of the exams and the closure of schools.
You don't just shut down schools out of panic. You have to do the proper testing. You have to ensure that the systems you've put in place are working. So, for example, if there's one suspected case and there's no surveillance, first of all, how do you even find a suspected case? Because you have a surveillance system in place that will suspect the case. Then you proceed to test that particular case. Should you find a positive case, you are going to move into this isolation and treatment and support so that the person can come back and continue, like what we've seen in Accra Girls. But once you find the positive case and they do the contact tracing, then they can test that at-risk population. Is it the same dormitory or the same class or whatever? But however they define the at-risk population, they can test them. If by the time you are done, a school population of 400 students, 3 or 4, or in some of the schools, 1 student, you don't proceed to say you are shutting down the school.